Proposition 4, should the state of California issue $1.5 billion in general obligation bonds to expand and improve the buildings and equipment at children's hospitals? Children's hospitals provide specialized physical and mental health care services to infants and children. There are 8 nonprofit hospitals, 5 University of California children's hospitals, and more than 100 other nonprofit hospitals that serve children with complex chronic health conditions who are eligible for California's Children's Services Program. Over half the patients receive Medi-Cal benefits, and only a small amount of funding remains from the previous bonds. Proposition 4 would raise $1.5 billion through the sale of general obligation bonds. Use the funds to improve and expand children's hospitals. The money could be used to build new facilities, to improve and expand current facilities, and to purchase new equipment. To obtain funding, a hospital would apply to the California Health Facilities Financing Authority of the State Treasurer's Office, which would award the grants based on factors such as improving healthcare access and patient outcomes. The 8 nonprofit children's hospitals would be eligible for 72% of the funds. The rest of the funds would go to the University of California's Children Acute Care Centers and to nonprofit hospitals that care for children eligible for government programs. The budget effect, the state would need to repay a total of $2.9 billion, which is made up of the original $1.5 billion bond and $1.4 billion in interest that would be paid back over 35 years. The yearly repayment amount is about $80 million. The folks who support Prop 4 say children's hospitals care for California's most needy children, no matter what their families can pay. Prop 4 would keep our hospitals up to date and ready to serve more children. Prop 4 would help over 2 million sick children each year and lead to better health outcomes. Previous bonds have been used to add more beds and purchase new technology. The folks who are against Prop 4, Prop 4 would require the state to borrow money and pay it back over many years. Instead of borrowing money, California should be looking at improving healthcare overall, and the bond would need to be repaid potentially through higher taxes. That's Prop 4.